Welcome back to DDW TV. And I have the pleasure now of being joined by Dr. Fola May. Dr. May, thank you so much for coming by and joining us.
Thank you for having me. It's a pleasure to be here.
Fola is the director of the UCLA May Laboratory, which is a health services and clinical research team engaging in research and quality improvement relating to population. I want to get all that in as groundwork here. Tell us a little bit about the May Laboratory first.
Absolutely. So the May Laboratory is a clinical research lab that's based at UCLA Health. We perform research at UCLA, but also in the VA and in federally qualified health centers. And really, we focus on improving the quality of gastrointestinal clinical care. We do a lot of work focused on cancer prevention, specifically colorectal cancer prevention, but other cancers as well. And we're working in everywhere from patient populations that are being seen at UCLA to community populations, trying to figure out how we can give them the best value of care, but also make sure that they get their preventive services as recommended.
You were talking about colorectal cancer, which obviously is a focal point for much of what is going on here at DDW. Your session also dealt with that a little bit as well. Give us some thoughts, if you would, on how the rise in non-colonoscopy colorectal cancer testing options is improving or has improved the CRC screening landscape.
Absolutely. I love that we focus so much on colorectal cancer here at DDW. It remains the second most common cause of cancer-related deaths in the United States, and it disproportionately impacts low-income African-American individuals. It's an area that I have a lot of passion about, and there's so many fantastic sessions about it here at DDW. We really are trying to focus on how we can develop interventions that make people more aware about cancer prevention strategies. Then we can empower individuals to take that effort to get a cancer screening test. In many cases, that can save individuals' lives. I like to tell patients that if we can diagnose your colorectal cancer at stage 1, the survival is 90%. But if we wait and we delay screening and the cancer screening doesn't happen and you have a stage 3 disease, the survival drops all the way down to 11%. So it's critical that we have these interventions in the community and in health systems. We make people aware about the life-saving potential of screening and that we get as many people screened as possible.
You've touched on it a little bit, but what are some of the challenges to the follow-up after non-colonoscopy tests?
Yeah, so there are many different ways to screen for colorectal cancer. We're kind of lucky compared to other types of cancers. There's actually 7 recommended strategies for screening. Colonoscopy is the most common one, but as you mentioned, we have seen a rise in non-colonoscopic screening tests. These are screening tests often that you can perform at home, like some of the stool-based tests, and it really has increased access to screening. We've learned in our field over time that when you limit the option to colonoscopy, you have a large proportion of the population that's not going to participate at all. So by varying the screening options, we have more people now participating in the screening. The challenge, though, is that these non-colonoscopic screening tests are 2-step processes, meaning that you need to perform the first test, and if that lights up as positive or abnormal, then you actually do need to go for that diagnostic colonoscopy to see if you have a polyp or a cancer. So a lot of the work that we do in our lab and that people around the country are doing are trying to understand what we can do to motivate people to taking that second step if they have an abnormal stool-based test, like a FIT test or a Cologuard or other non-colonoscopic test.
Well, you led right into the next question, which is what are some of the practices that are things that can be done to implement and promote colonoscopy completion after some of these abnormal tests?
Yeah, it's an area that's far understudied. We have a lot of research and implementation science that looks into ways to get more people screened, as we've talked about, and I think we've had great progress in that area, although still much work to do. But we lack the studies that look at how you get people to follow up when you have an abnormal non-colonoscopic test. What we know is that there are a few things that are very effective. One of them is patient navigation. So when we get individuals, they can be lay health workers or health workers, when we get them to get on the telephone and call patients who have had an abnormal test, tell them the importance of that follow-up colonoscopy, walk them through the barriers that are preventing them from getting that colonoscopy, they're much more likely to get that done. We've also learned that some health system interventions, little tweaks in the EHR, nudges to the provider and the patient through letters, mailings, through even text messages or portals through the health system can be very effective in reminding patients the importance of that follow-up examination. But it's an area that I think a lot of us are very interested in, and I'm hopeful to see more science and more research in the future.
And we certainly all are. Dr. May, thank you so much. Thank you for your work with the May Laboratory as well.
Thank you very much.
And this is DDW TV. Of course, if you would like to discover more content, you can always check out ddw.org.